Several years ago, we found that a lot of the kupuna were being sent off island or, just didn't have, their relatives didn't have help to take care of them. So we have a lot of people out there that we know need to be somewhere.
The Pu'uwai primary services consist of preventative health care, exercise, and chronic disease management for our Native Hawaiian population on Molokai. One of our goals is to provide kupuna care in our community. We've begun adult daycare at one facility.
A lot of people who are independent and know they're independent think, I don't need daycare because it's for people that are sick or, they have a misconception.
Personally, when my grandma was supposed to come, I always said, no, I don't like her come. But when you see that they do nothing at home, they only sit down, look TV, they're not getting the things they need. They need communication outside of the family. They need to network with others. They need to constantly do things with their hands.
I think their biggest benefit is to be at a place where they're well cared for, instead of being home alone or unattended. Their biggest benefit is to socialize and interact with other kupunas as well as the staff.
And I think it's part of our island or our style of living. Everybody is like family.
We enjoy moments where friendship, we have fun.
Many times I've heard that they're so thankful that they have a place here, and it's not really the program a lot of times. Sometimes it's just having another, a friend who is their age, who understands them, and being able to talk story with them and spend time with them.
You need to eat.
You raw vegetables.
Salad.
I love it. Otherwise, I'd be sitting at home doing nothing. So I like to come here and be with all my friends and talk stories.
If you see the calendar for the day, it's really packed full. They do journal writing, they do puzzles, they games, they articulate their feelings.
It's already planned for every hour, and it's really keep us alert.
Well, it's wonderful.
Early in the morning, my father-in-law was in the mountain, and he realized something wrong. So he came rushing home and told us that it's war.
We do Tai Chi with them on a daily basis. We also do craft, tabletop activities.
Zumba comes over here, and they really like that.
We do take them on weekly field trips to Pala'au State Park. At times we'll go to Kumu Farms, or if there's certain activities in the community, we try to, take them. Just being outside and seeing the ocean and nature, I think that really helps them a lot, just to feel relaxed in a different atmosphere.
And sometimes when you take them to places, they remember of things they used to do with their families. We take them to the Pu'uwai gym with Peter. He does the range of motion with them.
5, 6, 7. We do some stretching and resistance training just to get their bodies moving and get some blood flow through parts of their body that they usually wouldn't use.
It's a safe place, it's licensed, the staff are, certified as nurse assistants.
We watch for any signs of sickness or illness, neglect, any signs of depression or mood changes.
They can talk about some of their feelings in the group. They can feel comfortable to share in a safe place, and they can also problem solve about how to feel better when they're feeling stressed or when they're feeling angry or scared or sad.
It's not only one safe environment, one place they can learn, but I think our place is really loving and warm, So I think if the community would know about it, they can actually help those too who need the help and assistance or the services that we provide.
This is available for all, for all kupuna, and it's actually to give some respite to the family or the caregivers.
It gives them a break. It allows them to continue to work outside of the home, bring in an income, and also they know that their loved one is safe, they're in a safe environment, and they're engaged.
This is what the message we want is that daycare can be for you or can be for your loved one.